Everybody, for a update on where we are with COVID-19 in Colorado. I want to start by acknowledging that we've lost 5,874 of our fellow Coloradans to this deadly virus, over 500,000 Americans, and I express my condolences to every family of somebody who was lost, everyone, a brother or sister, aunt or uncle, father or mother, son or daughter. Today, we're reporting 1,521 new cases. That's a significant increase from where we've been the last few days. We have succeeded in getting the testing back up. Again, that's a function of people being tested when you're ill. Very important. If you have any symptom at all, please get tested. It's so important that we identify those cases early so you can warn your loved ones that what you have might not be a cold, but is COVID. We did 39,000 tests yesterday. We were above 30,000 yesterday, too. The state has the ability to do well over 100,000 tests a day. It's just that people need to request them. And we are higher than where we had been last week. So we're getting better visibility, but 1,521 cases up. Thankfully, hospitalizations, the trailing indicator, continue to decrease. We're at 358 hospitalizations. Wonderful news. 59 people were discharged in the last 24 hours. Obviously, some were admitted as well. So the number just went down by 16. So we are in we hope, a stable trend. We hope this is not a harbinger of a increase. And again, the most important thing we can do, we know how to lick this thing. We did it in January. We did well. We did it through most of February. So let's not ease up now. We're going to be talking a lot about vaccines today. Very exciting. It's how this ends for people that are vaccinated. They're going out, and finally, people in their 70s and 80s are able to be out without fear once the vaccine takes hold, 2 weeks after the second dose. But it is not over yet. So wear a mask. Avoid social gatherings with people outside your home. Keep a distance. Be careful. A lot of good news on the horizon, but we're not there yet. Today, we're going to provide an update on vaccine prioritization. Whenever we talk about vaccine prioritization, it's always based on how many vaccines we're getting. And as you know, as recently as 2 months ago, we were only getting a 3 or 4 day notice on how many vaccines we were getting. Very difficult to plan phases, very difficult to plan clinics even with that. We now have, and Scott Sherman is here, Brigadier General Sherman is here, who oversees our supply. We now have a 3-week horizon that we're going to walk you through on numbers. We also have the director of the Unified Central Command Vaccine Joint Task Force. That's a very long title. Director of the Unified Central Command Vaccine Joint Task Force. Scott Bookman is with us. And as well, incident commander. So we'll give you the updates on the numbers, but what we want to do is, when we say there's vaccines and you're eligible, you shouldn't have to wait like 3 months, right? We want to get through a group in a reasonable amount of time. What's a reasonable amount of time? Now, it's subjective, but we think 3, 4, 5 weeks, if you're up, is reasonable, right? If we can get through a group in your age group, or in 4 weeks or so, reasonable, right? You might not get it today. You might get it in 4 weeks, but you're talking about it in that time frame. So we try to align those numbers that way, rather than, as some states erred on the side of too narrow eligibility, right? Where once you're up, you don't necessarily have to wait, but it slows down the vaccine distribution because you wait till every last one of the prior group gets it, and then you move on. And there's states that are way behind us in getting vaccine into arms, which at the end of the day is how we end the pandemic. Other states have erred, too large a group, and then you have, people lining up all night and no one getting it, and everybody's frustrated. That's probably a better error than the first error, because there's no excuse for slowing down. But we want to have a reasonable way to set expectations with people that, yes, if you're in this group, you'll get it in 3, 4 weeks, 5 tops. And you will, and we'll be able to demonstrate that. So what we'll be announcing today, and is that members of the general public age 60 and up will have full access to the vaccine starting March 5th. So starting March 5th, if you're 60 and up in Colorado, you can schedule an appointment with your local pharmacy, your hospital, community health clinic. You'll be eligible to participate in any of the stand-up clinics across the state. General Sherman will talk about some of the pods that are being created. So 60 and up, March 5th. And then we're further announcing that in late March, and we believe that date will be March 21st, But it might change a day or two just based on exact supply numbers. I hope it can be moved up to March 18th, but worst case, it might be March 22nd or 23rd. But around March 21st, we'll be expanding to anybody aged 50 and up in our state will be able to get the vaccine. So those are the big announcements today. And just to be clear, everybody who's 65 and up is now eligible to be vaccinated in Colorado. You can sign up at your local pharmacy, your hospital, your provider. We are mostly, we'll talk about the updates and where we are in 70 up, mostly through 65 to 69. Obviously, we'll take another week or two to get through most of that group. And then going to 60 and up March 5th. And then around administered 882,703 first doses and 423,237 second doses. In phase 1A, they're essentially at the finish line where the workers who want it have received the vaccine. And I'm proud to say that it's a higher percentage of healthcare workers than most other groups. 90% of frontline healthcare workers, those who work in COVID wards, putting their lives at risk, have received both doses of the vaccine. So look, these people know something about it, they've seen it, and at 90% rates they're getting vaccinated. You should too, right? Take it from those who work in hospitals, who see it every day, that, this is an amazing vaccination rate, 90%. We should follow that lead, right? When you're up, go, right? You're 65 and up, go, do it. When you're 60 and up after March 5th, when you're 50 and up after March 21st or so, do it. It's wonderful to see, and of course these are the folks that see and know the most about COVID-19, and they're getting the vaccination at record rates, and we're very excited to see that. We've also completed vaccination of essentially all of our residents in long-term care facilities across the state, really one of the most vulnerable groups, and that program is complete. Largely will be completed in the next 10 days. There's some folks who missed second doses and had their first dose when others had their second dose, so there's finishing up a few. But by and large, that program is complete. People in our long-term care facilities are protected, and with that comes the ability for life to return to much more normal for them. So, finally, we'll be getting back, poker night and movie night and ability to see loved ones. It's really wonderful news that we are nearing protection of really our most vulnerable cohort, which has represented a disproportionate amount of deaths in Colorado. So 90% of moderate risk healthcare workers and first responders have received their first dose, and we are charging ahead on protecting our most vulnerable. We are at 67% of Coloradans 70 and older, 37% of Coloradans 65 to 69. I'm still confident that we are on track by February 28th, by Sunday, to be at 70% of people aged 70 and up. We will have that data for you by Tuesday. So we will know exactly where we are with 70 and up through the weekend, through February by Tuesday. I'm confident we'll reach our goal. And by the way, we do hope that number still goes up. If you're 70 and up, it's not like you miss a window. If you haven't signed up or you signed up somewhere and couldn't make the appointment, you can still go. Absolutely. You're prioritized. We want you to get it. So we would love that number to reach 75 or 80% over the next month. It would be wonderful if more people over 70 seek out and get the vaccination. Same with people over age 65. Obviously, there's a lot more in line now and waiting. We're at about 37% of people age 65 to 69. And that's a good window because while we are rapidly getting through the 70 and up, we have more 65 and 69 to go. And so you'll have a good opportunity to get the shot and vaccinated in the next week or two for many people in that range. And we're a big part of the way towards our goal and on track with that as well. And we're also on track with educators. As we talked about, our goal was 75% by March 5th, hoping that 75% want it, but yeah, we think we'll be around that range. And we're at 64% now. So no surprise there, 64%. We're very excited about that. Since the beginning of this pandemic, we've really approached this process in a way that tries to save the most lives and is equitable and ends the pandemic and public health crisis as soon as possible. That's really been our overarching principle. get it out, get it into arms, end the pandemic, save lives. People over 70 represent 78% of the fatalities from COVID-19 in Colorado. So we're protecting that group is so important. And by the way, when we reach and we certainly hope we do, 70% of people over 70 by Sunday, that doesn't mean they're all protected yet, right? That just means first dose. Some of them have gotten their second doses already, of course, and some are 2 weeks into that, but some of them are just getting their first dose this week or this weekend or last week. And so they're on the protection clock, but they are not yet protected with a highly effective and safe, life-saving vaccine. You know, when we came together nearly a month ago, I told you that it really depended on our supply. We would start vaccinating folks in 1B3 in early March. We estimated about March 5th, and actually we're on track for March 5th, which is very exciting. We're tiering it to make sure that people, again, get it within a few weeks of when you're eligible. It doesn't do you any good to say you can get it and then no one can get it for 2 months or something like that. We want to make sure people know when they're going to get it. But as we take this next step, we're doing everything we can to maximize the impact of vaccine distribution efforts and save the most lives. To put it bluntly, we want to make sure that Colorado gets this right. So today we're announcing an update to our vaccine prioritization. To do that, given what we now know about our vaccine supply, just in the last few days where we've gotten that 3-week lead, also knowing through our state demographer and other analysis the amount of people that are in different groups, we now have the calendar for implementing 1B3 and 1B4, kind of the 2 tiers of what we have in 1B3, targeting the most at risk, focused on building our infrastructure to get vaccines into arms. Why are we focused on these categories? And by the way, on March 5th, it's not only 60 and up, it's also people who have 2 significant pre-existing conditions that make them at higher risk to COVID. And so there's a medical lens on that as well. We're doing that along with ag workers and grocery store workers. We're doing that because some people are at higher risk because of the nature of their work, right? So we talk about restaurant workers and bus drivers, and we'll be able to get many of them done in the period starting around March 21st over the next 3 or 4 weeks. So it's really about matching numbers with available vaccine and making sure that if you are up, you have and you want to get vaccinated, you'll have the opportunity to do that within a few weeks, right? Within 3-4 weeks, you'll be able to get that. Some on day 1, some, that 4th week, but a reasonable expectation of aligning the numbers with the groups is kind of the matchup work we've done, so people know when they're going to get it. So March 5th, as we'll talk about. Some of the critical food supply workers, anybody 60 and up, 2 existing preconditions. Around March 21st, 50 and up, higher ed, restaurant workers, bus drivers, people that are public-facing essential workers that really aren't always able to do social distancing in their environment will be eligible regardless of age. And then everybody 50 and up will be eligible around March 21st. So before we go into the details of the new phased approach and kind of how we're tiering that, I want to give you some more visibility into what we know about supply, obviously also subject to any updates or changes from the federal government. But frankly, I feel pretty good about it in the sense that I think that it would, if it's amended, it would likely be amended upwards. They like to give us some good baseline numbers, and we're hopeful that especially in week 2 or 3, maybe those numbers will be slightly higher, but we base it on the numbers they give us. And I'm proud to turn it over to Brigadier General Sherman to share more information on what we now know about our vaccine supply.
That we're going to get allocated to us next week. We know that the emergency use agreement is probably going to be approved today. We're waiting on the advisory committee on immunization practices to put out their guidance. We'll probably get that Sunday or Monday, and as soon as that's approved, we'll be able to order that and receive those 45,500 doses next week. And we're being told by the federal government that there will be 20 million doses for nationwide for the Johnson & Johnson vaccine. Our share of it, we think, will be 400,000 coming in by the end of March. So we are definitely have a good handle on what our allocation is going to be. Just want to caution everybody, just first say what a great job that our providers, our pharmacies, our local public health agencies, the great job they're doing on getting this vaccine administered to Coloradans. And really want to stress to everybody, please be patient, sign up for an appointment. And certainly as we announce this phase, please, and we put more people into the phases, sign up, please be patient. You will have your turn to get a vaccine. And just what a great job that our providers have been doing. Next slide, please. So we do expect next week that the White House will make an announcement on the increase of vaccine that will be available for the states moving forward. We expect a really strong increase the last week of March into the first part of April. Now, in order to prepare for that demand, we've worked with our hospitals, our pharmacies, our major healthcare providers to help really set up community vaccination sites. You'll see here on the slide, we've listed the 6 sites that we're focusing on right now. We're really working with El Paso County and their public health agency for the ranch up in Fort Collins or up in Larimer County. Then down in Denver for the Ball Arena. Appreciate everything City of Denver's doing there. And then with Adams County for Dick's Sporting Goods. And then El Paso County and the Broadmoor World Arena down in Colorado Springs. Then Pueblo County and City of Pueblo, everything they're doing down there for their site that they'll have down there in Pueblo at the Pueblo Mall. And then for Mesa County, the great work that they're already doing so far, but we're going to expand their site at the Grand Junction Convention Center. And our goal is once allocation increases, we want to get these to Tier 1 sites. So that's 5,000 to 6,000 shots administered per day. And we certainly think that into April, we'll see that allocation increase so that we can get to that level. Next slide. And I'll pass it over to Director Bookman.
Thank you, General Sherman. Thank you all for joining us here today. I do want to take a moment to recognize the incredible work that General Sherman and his team are doing for all of the incredible logistics around moving this vaccine across our state in the most efficient and effective way possible. I, too, want to thank all of the healthcare workers, our healthcare systems, our local public health, our federally qualified health centers, and all of our other providers who are working so hard to get this vaccine into arms as quickly as possible. This effort requires incredible flexibility, innovation, and patience. And I do want to thank all the Coloradans who are doing all that they can to sign up to get this vaccine. Getting this vaccine is safe, it is effective, and it is the critical next step in moving forward in ending this pandemic. But again, we do have incredibly limited federal supply at this point. While it is increasing, we do need people to be patient until that vaccine supply increases. Today, I'm going to walk you through our updated phasing, Phase 1B3 and then Phase 1B4. As supply has increased, we have taken the opportunity here to parse out what was 1B3 into 1B3 into 1B4 to make sure that we are prioritizing those who need it the most as quickly as possible. So in Phase 1B3, we are now including agricultural workers, grocery workers, Coloradans who are 60 years and over, and Coloradans 16 to 59 with 2 or more comorbidities. I will walk you through the comorbidities in a future slide here. Next slide, please. So in Phase 1B3, we now estimate that there are approximately 958,000 Coloradans. There's about 20,000 agricultural workers, 200,000 grocery store workers, approximately 400,000 people between 16 and 59 with 2 or more of those comorbidities, and 338,000 Coloradans ages 60 to 64. So this is another large chunk that we're working our way through. And again, everybody's going to get their turn, and we're excited to move into this phase on March 5th. Next slide. So I want to talk a little bit here about how people in each of these groups will go about receiving their vaccine. So agricultural processing workers, and these are people who are currently employed in the field, will be eligible for vaccine as of March 5th. We are working with some of our largest agricultural producers, such as Cargill and JBS, to provide access to the vaccine directly at their site or through a regional community vaccine site. Grocery workers, again, those who are currently employed grocery workers, will also be eligible on March 5th. Obviously, for groceries that have a pharmacy in-house, that will be the primary place where these workers are able to get their vaccine. For grocery workers who do not have access to a pharmacy in their facility, we will work with their employers to ensure that they have access to our major health systems and to our local public health to ensure access to this vaccine. Coloradans who are 60 and older, starting on March 5th, will be able to work with any enrolled provider. This includes our federally qualified health centers, our large health systems, our local public health, to begin accessing the vaccine. And then in mid-March, as General Sherman indicated, we'll be standing up larger community vaccination sites that will also provide access to Coloradans 60 and over. And then finally, Coloradans who are 16 to 59 with 2 or more of these comorbidities will receive the vaccine in a similar way. Next slide, please. So a little bit more specificity here. If you are a current agricultural processing employer that needs help connecting with a provider, you can visit our website to fill out a form, and the state will work with you and your local providers to ensure that you have access for your employers or for your employees. And if you are an employee of an agricultural processing facility and your employer has not been able to connect you with a provider, then we would encourage you to work with a local provider such as a healthcare system or a federally qualified health center. Next slide. Current grocery store workers will be eligible, again, on March 5th. These are people who work in close contact with others while working in a grocery store. Again, schedule your appointment through your in-house pharmacy. And if your in-house pharmacy, if your facility doesn't have an in-house pharmacy, you can work with your local public health agency or a provider nearby. Next slide. So, Coloradans who have 2 or more comorbidities between the ages of 16 and 59 will also be eligible as of March 5th. Please contact a local vaccine provider, such as a health system, pharmacy, or federally qualified health center to begin scheduling your appointment. If you have trouble identifying exactly who those providers are, please visit our website or call our hotline at 1-877-COVAX-CO. Next slide. As I mentioned, we are continuing to be open to those who are 16 to 59 with 2 or more high-risk conditions. This is a visual of the sample registration form that people will use, and this is a self-attestation process. And so for Coloradans who believe that they have one of these conditions, if you're between 16 to 59 years old and you have 2 or more of these, you are eligible to receive the vaccine. This means that you have you're either currently receiving cancer treatment or have been treated within the last month. You have chronic kidney disease, COPD, diabetes, Down syndrome, several specific heart conditions. You have obesity with a BMI of greater than 30 kilograms. You've got sickle cell disease, solid organ transplant. I also want to call out that individuals with disabilities who require direct care in their home and individuals with disabilities that prevent them from wearing a mask are eligible in this phase. Next slide. And as the governor indicated, we are opening up as of March 5th to all Coloradans who are 60 years and older. Again, work through your local vaccine provider, such as a health system or a federally qualified health center or your local public health to receive your vaccine. Next slide. We are looking ahead to opening up to phase 1B4 later in March. This is a much larger group of Coloradans. It's going to take several slides to run through this, and there will be more definitions available on our website. But 1B4 will include people ages 50 and older, student-facing higher education faculty and staff, frontline essential workers in food and restaurant services, manufacturing, and the U.S. Postal Service. Next slide. More frontline essential workers, this time in public transport, specialized transportation, critical frontline public health and essential human services workers, faith leaders, and frontline essential direct care providers for Coloradans who are experiencing homelessness. Next slide. Frontline essential journalists, continuity of local government, continuity of operations of state government, any adults who received a placebo during their COVID-19 vaccine trial, and then people who are 16 to 49 with one of those higher risk conditions. Next slide. This is a large phase. 1B4 will comprise approximately 2.5 million Coloradans. Now, this is a rough estimate, and obviously as we get lower down in our phasing, some of these people who are receiving it because of the work that they do may have already received it because of their age or other conditions. And so, again, these are rough numbers, but they are large numbers. And so it is going to require patience, and it is going to require a significant increase in vaccine supply as we move forward through this phasing. The goal of 1B4 is really to ensure that those who are exposed to COVID because of the work that they do have access to this vaccine. These are people who work in an environment where they have to work closely with others, possibly indoors with poor ventilation, and so we want to ensure that they have access to this vaccine as rapidly as we can provide it. Next slide. We anticipate that we'll start this phase in late March, possibly as early as March 21st. Next slide. After that, we will assess the overall vaccine supply, and we will move towards phase 2, which will be the general public. We're still working to identify exactly when that will happen, and again, that is all pending federal vaccine supply. For those who are now eligible in phase 1B3 and who will be eligible in 1B4, we will be providing an update next week on the best way to sign up for this vaccine. Our providers are working rapidly to update their systems to accommodate our new phasing, and so it will take them a couple of days to incorporate this into all of their systems, and so we will provide an update next week on that information. Next slide. And Governor, I'll turn it back over to you.
Thank you. So what's also important to note, this is the last complicated tiering that we're talking about. After this, it's general public. And if we have to further divide based on quantity, it would be simply by age, right? So it might be 40 and up and then 39 and under. It all depends on quantity. And we're confident that this is, again, going to be that kind of 4 or 5 week period. So if we get to it March 21st, it means that end of April, first week in May is when it's general public, or perhaps 40 and up or 35 and up, depending on quantities. But this is the last of this very difficult work of trying to figure out by occupation, because every Coloradan deserves it, every occupation deserves it, every age deserves it. We're all going to get it if you want it, and I encourage you to seek it out when you have the opportunity. But we want to get away from this complexity as quickly as possible, and so this is the last phase of that, and it'll open up after that. There might be age segmentation, but March 21st, we have a good group of folks, everybody 50 and up, a number of other folks depending on their occupation. That should take us through April. So last week in April, first week in May, sometime in that time frame, it'll be very simple where it opens up, right? And it'll just depend on numbers. It'll either be everybody, or it'll be 40 and up, or 35 and up, or something along those lines, starting, as I said, hopefully by the first week in May. We don't yet have the visibility on those April numbers. That's why we can't give you a date. We have a good sense of the March 21st date. Again, could be 2 or 3 days earlier, could be 2 or 3 days later, but pretty good sense of that. And this is the last complex phasing. It just goes to age-based, general public after this phase. Very easy to get, and really it'll very quickly become more of an issue to make sure that people do get vaccinated. And we want to encourage you, when you're up, get vaccinated. Don't think twice. Don't feel guilty. Sign up and do it. Right? You might be a young, healthy grocery store worker who's 29. By getting vaccinated, you're helping to protect the entire community. We need to reach 70% or so across all demographic groups. So no matter what your age, no matter what your health, you are helping defeat this deadly virus when you step up when it's your turn to get vaccinated. So we're starting March 5th, 60 and up, people with 2 comorbidities, some of the folks that work in the big food processing plants, and then around March 21st, rapidly going to restaurant workers and higher ed workers and bus drivers and postal workers and so many others. I want to reiterate, it's about 1 million people in 1B3, and that is going to take some time. As we said, we expect it'll be, 4 or 5 weeks, end of April, early May. If you want it and you're in that group, should be able to get it. That's just 1B3, sorry, you'll have it within every group will have it within about 4 or 5 weeks. So if you're in the first tier of 1B3, you'll have it within about 4 or 5 weeks, and same with the second tier. And so that means you might get it next week. It might be in 4 weeks. But patience is key, right? And we know the numbers, we know the groups, we know you'll get it. Doesn't mean everybody, just the number, everybody can't get it that first day you're eligible. The maximum number will, every single day. We're going to use every dose every day. And also, I want to make sure people are patient to let the providers update their systems to account for these changes. So if you're, oh my gosh, I'm 61, where do I sign up? Or I have 2 comorbidities, just relax a few days, let our providers catch up. They're going to get everything updated early next week. We'll have info next week that we'll announce on how to sign up if you're in these groups. But you don't need to rush to sign up. These are going to be, they're just like our last ones, they're randomized. It's not first come, first serve. We don't want to reward people who have to get out of bed and go somewhere at 2 a.m. You're on a list, it's randomized, they'll pick you, you're eligible. Obviously, if you want to set up a time at a pharmacy, you go online and do that. But the providers are going to be updating their own registration systems, pharmacies, community health clinics, hospitals. So if you're in any of these groups, you'll be able to sign up next week. But just be patient here. They need to update that to account for these changes. And we'll provide more details next week. And I want to take a moment to thank all of our providers, our hospitals, healthcare workers, community health clinics, pharmacies, who've remained nimble throughout this process. Just like it's been frustrating for us not to know the quantity of vaccine for the next few weeks, it's been even more frustrating for them. And they've adapted with every phase. We've all rolled with the punches, and so have they, and I want to thank them. Really, our providers, that your work is critical to helping our state end this deadly pandemic and end the health crisis, save lives, get our lives back. So look, this has a lot of moving pieces. We're aiming for simplification, which is why this is the last piece of the phasing. It simply goes to general public, potentially based on age, in late April, early May. Very excited about that. But we're moving forward with this plan because of what we know now about the science and our supplies, and because we firmly believe that this is the best course of action for the state of Colorado. We're moving as quickly as we can, making every effort to get it right. Everybody is equally worthy of receiving the vaccine, and everybody will have the opportunity to receive the vaccine if they want it. We continue working with the White House to get clarity on vaccine supply. If we get additional clarity, we'll have more specific dates around some of these other changes. We await that, but until then, we'll just present you with the numbers we have when we have them, so you have full transparency and visibility into our process of how we can make sure the vaccine gets into arms and ends the pandemic. If you have any questions, if you are looking for information on the vaccine or where you fall on the prioritization list, go to covidvaccine.org, or if you're not comfortable with the internet, call 1-877-CO-VAX-CO to get more information. Again, if you're in any of these new groups, if you're 60 and up or have 2 comorbidities or 50 and up or work in a restaurant, have a little bit of patience. Our providers are going to update their systems for next week. You'll have information on signing up. They just got this, moments before you. We told them just hours ago. So they're going to be updating their systems. They're committed to doing that. But give them a few days. It won't set you back one moment in getting the vaccine. If you give them till Tuesday or Wednesday to update their websites, it won't delay you because these are the groups we're talking about that start March 5th or start March 21st. So it won't delay you getting the vaccine, but just have a little bit of patience as everybody upgrades. And keep in mind that right now we're focused on 70 and up and then 65 to 69 through March 5th. We want to get through as many people that are particularly 65 to 69. There's still some folks 70 and up. If you've been sitting sitting on the sidelines and you're 70 and up, now's the time. Your eligibility doesn't go away. You can absolutely get it in 2 weeks and 4 weeks, no issues. But it's a great time to sign up now to get vaccinated. Our state is very close to our goal. The journey's not over. The race is not yet won. We need to continue to be very patient. And that's not just for people that are patient in signing up for a vaccine. We need to be patient around the measures that we are taking to save lives. When you do the math, there are plenty of Coloradans that are not protected, meaning they haven't had it, don't have antibodies, haven't had a vaccine. There are more than enough Coloradans, probably as much as 60 to 70%, that are still fertile ground for this virus to have a third peak in our state. Okay? So we need to get that number will rapidly decrease over time. But at this moment in time, there is still fertile ground for the virus to grow if we give it the opportunity. Wear a mask, avoid socializing with people outside of your home whenever possible, keep a distance of 6 feet, keep all these precautions up the next couple months, then we're through this. I want to thank Brigadier General Scott Sherman. I want to thank Incident Commander Scott Bookman for joining me here today. Happy to take some questions. Yes.
Prompt question. You've addressed this issue on a number of occasions. We always get a lot of phone calls from viewers who have loved ones that haven't been able to get their appointment. And I don't know if anything's changing with these community sites that you announced that are taking place this weekend. Some have available appointments, some are just for the second dose, and many are just taking names from a list of people that have already made an appointment. Can you tell anybody that's out there watching what they need to know about these clinics this weekend, and for those that still haven't been able to get an appointment?
And this is what's frustrating. Just because you're eligible doesn't mean you can get it within a day or two. Because we've walked through these numbers, you're eligible. We feel confident that you're going to have the chance to get it in 4 or 5 weeks, right? Some on day 1, some on day 26, some perhaps on day 32. We can get through that group over 4 weeks. That's frustrating to people because they hear, hey, I'm 60 and up. I'm eligible March 6th. I want it March 6th. And guess what? Some 60-year-olds that are randomly selected will get it March 6th, but others will get it March 15th, others March 18th, others March 23rd. We are focused right now on 70 and up and 65 to 69. We're rapidly moving through those groups. There's a window up until March 5th where they're the only folks that are out there and eligible, aside from the teacher program, which is separate. And there's several great folks that have put together automated ways to look at this. I've linked to a COVID vaccine finder. There's also a great new Twitter account. It's CO Vax Alerts that you can sign up for, and you get every vaccine alert in Colorado. Every few moments there's one. And you don't need to run around the state. I mean, if you live in Pueblo, by all means, it might be Pueblo, it might be Colorado Springs if you're really anxious, but you don't need to sign up for one in Fort Morgan or Leadville. They're all over. I mean, I check this stuff regularly. CO Vax Alerts, at CO Vax Alerts, sign up. It was done by David Witten, who has family in Aurora and Denver that were having trouble finding appointments. So he set up this bot that also scrapes the screens from what Nick did, another enterprising Coloradan who works at NRAL. So plenty of opportunities. But the key thing to know is all you're doing by going through all this effort is, you might get one a little bit earlier, 3-4 weeks earlier, but everybody in the group will have the opportunity to get that within a few weeks, right? 3, 4, 5 weeks. You're up, the numbers are there, you'll get your shot. And some people, by the way, most people don't even need to sign up. You might not know this, but if you're, and a lot of people haven't signed up and have gotten vaccinated, you're like, how did I do it? It's because if you were a patient at any hospital or any healthcare system, UC Health or Centura or Kaiser, you just get the invitation based on your age. You don't need to sign anywhere else. You don't need to sign anywhere else up. If you don't think that you are in any system because you've gotten really no health care with a provider in a number of years, then you can sign up at one of the online lists. And the other reason people sign up at online lists is they want to be on 5 or 10 lists so that they go 2 or 3 weeks earlier. That's fine. You can do that. You're still going to be up even if you don't sign up because you're on, Kaiser knows you exist or Centura or somebody knows you're out there. But you're absolutely welcome to sign up on several lists or to schedule your own appointment at a local pharmacy. And that's what the CO Vax Alerts has. It has all the different opportunities to sign up at local pharmacies. If you're 65 and up and starting March 5th, if you're 60 and up, starting around March 21st, if you're 50 and up.
Hi, Governor Ali Levine with 9 News here. How do you plan to confirm and enforce people's eligibility as frontline workers if they aren't required to get their vaccines through employer-based clinics? Is it just going to be based on the honor system? And then quickly, I know you said you were aiming to simplify, but at this point, phase one seems a little bit confusing. Why the decision to parse it into multiple groups and subgroups and sub-subgroups instead of just dividing distribution up between phase one, phase two, phase three, phase four, and so on?
Yeah, so we want to end all this complex phasing as quickly as possible. With this plan, that'll be over by late April or early May, and it'll simply be based on age or the entire general public. The few kind of areas where we're focused on around March 5th, it's administered largely on site or special clinics. Like, so we go to JBS in Cargill, and it's on site for employees. Most of the grocery workers are be done through pharmacies. Now, of course, there are also small independent grocers that don't have pharmacies. They'll be able to work with their healthcare providers as grocery workers to do that. As we expand that further, in just a few weeks, bus drivers, restaurant workers, so many others, beginning in late March, and they'll be able to work with their providers. We'll have more information on how to sign up in these different categories next week. But the easier categories are the ones that are front-loaded because most of the grocery stores have pharmacies, and most of the ag workers are at a few large facilities that we are already working with them on the clinics to address the needs of their workers. The biggest group are members of the general public. So if you're 60 and up, you're eligible March 5th. If you're 50 and up, we don't have the date yet, but it'll be around March 21st when you are eligible. And then you can simply sign up with the provider of your choice or the pharmacy, the hospital, the community health clinic of your choice.
Rick Salinger from Channel 4. This is very welcome news for a lot of people. You talked about the numbers being relatively stable. Colorado was the first to discover the British variant. What about the other variants that have been popping up in numerous places? How might this have an impact here and what's being done to determine if they're present?
So I'm very concerned in tracking this potential increase that we're seeing with 1,500 cases today, just over 1,000 yesterday. We are not yet seeing an increased incidence of the variants in Colorado. That's reported to us every day. It's on the website every day. We do not yet see disproportionate growth among the variants. And part of that is because we are still doing a good job controlling the virus. It's the same measures that control it, right? They're less effective on some of the more contagious variants. Wear a mask, avoid others. All of these things work against any of the variants of the virus. And thus far, we also believe, based on the evidence, that the vaccine is highly effective against all forms of the virus, some less than others, but still highly effective against all variants.
Hello, Governor. This is Vinny Bell, Judice of Bloomberg News in Denver. Do you have a preference for the use of the one-dose J&J vaccine once it arrives? Target groups, rural, remote areas, for example. And I have a follow-up today.
So I think some consumers have a preference for one dose instead of two. I would also add that it is the easiest to move around the state and even within an urban area because it requires normal refrigeration, neither freezing nor extreme freezing conditions. So it's very versatile, very useful. A lot of people prefer going in once compared to twice. But my advice to everybody is when you have the opportunity to sign up and you're eligible, get vaccinated. Moderna, Pfizer, Johnson & Johnson, they're all highly effective. They're all safe. I want everybody to take every opportunity. Once you're up, roll up your arm and get protected.
And I'd like to also ask today, what's your best guess for Colorado to approach something like herd immunity. And what would you define as herd immunity? 70% of the entire population? Thank you very much.
Yeah, roughly 70%. That's more of a question for scientists and epidemiologists than it is for me. But the estimate that we're getting is about 70%. That's why we've targeted 70% threshold of 70 and up. We want to get to 70% of 65 to 69. And it might be slightly lower as we get to younger groups. We also have groups that it's slightly higher among, such as medical workers. But I'm confident with the information that's been presented to me that the pandemic will be over when we achieve 70% immunity.
Can you talk a little bit about the folks who are in phase 1B3 who are now pushed down a few weeks? I know restaurant workers have been really anxious to get this vaccine. Some of my colleagues who are journalists as well. What can you tell them about why they were moved down?
Yeah, nobody's really been pushed down. What we did is we collapsed phase 2. We used to have a phase 2, and it made it unnecessarily complicated. So we're done. No more phase 2. Simple, based on age. You get it. And obviously, older journalists and restaurant workers that are 60 and up should be getting it March 5th. It's simply a consequence of making sure that the supply and the demand align. And I think it would have been unfair to say, restaurant workers, journalists, all these groups, 50 and up, that they can get it March 5th, when in fact, the vaccines simply aren't there for them to get it. So we want to align when you can get it with when the vaccines are there for you to get it. And yes, restaurant workers, people 50 and up, others will be able to get it March 21st because the vaccine will be there and they'll be getting it every day. Not everybody will get it that first day or that first week, but they'll be able to get that over the next 4 or 5 weeks until everybody in that group is vaccinated. So I think it would have led to additional frustration if we told people they could get it March 5th, but in fact the vaccines weren't there for them.
Governor Charles Ashby from the Grand Junction Daily Sentinel. So it looks like that your mandatory mask order is due to expire by the end of next week. And looking at the state's website, it looks like most counties are in blue or yellow, and some of those yellow counties may be going to blue soon. What's your thinking about the mask order? Are you thinking about continuing it? Are you going to make it a recommendation? Are you going to do it based on color code, or are you going to leave it alone?
Yeah, first of all, let's start with that you should wear a mask to protect yourself, protect others. It's one of our most powerful tools in fighting the pandemic. We all talk about the highly effective vaccines. We're very proud of science for producing vaccines that are 95%, 85%, 75% effective, all highly effective. A simple mask, I'm looking for mine, is about 50% effective. So there's a vaccine today with unlimited supply that's 50% effective. Please take advantage of it and use it, regardless of whether it's recommended or ordered. It's the smart thing to do for yourself. It's a smart thing to do to keep businesses open. It's a smart thing to do to prevent a third surge of the virus, because there's still plenty of people left that are susceptible to the virus, probably 70% of our population. So it's very important in the final weeks and months of the pandemic, more than ever before, to continue to wear a mask and be careful.
So I'm sorry, does that mean you're going to keep it for another 30 days at least?
Well, what it means is that regardless of what, we said this, if it helps you to wear a mask because Governor Polis ordered it, then please wear it. If it helps you to wear a mask because Governor Polis encouraged you to, then wear it. If neither of those help and it's your doctor that tells you to wear it, then wear it. I just want you to wear a mask so we can save lives and end the pandemic. It really doesn't. I don't take any personal effect towards whatever message works. By all means, wear a mask. Nobody's ever, fined or ticketed or arrested, and no one, that's silly. But please, just wear a mask. Whatever form of communication makes it most likely you'll wear a mask, consider that form of communication the one that I'm communicating to you.
Governor, a question from a colleague of mine on a different subject. As a result of your meat-free holiday proclamation, a National Cattle Breeding Association says it may likely move its breeding show to Oklahoma instead of the National Western next year. Do you regret this proclamation?
Look, well, we do hundreds of these proclamations. People feel we do Colorado Ag Week, and we'd love to have a Colorado Beef Appreciation Day, and obviously Colorado lamb is well known and renowned with a premium across the country. I've focused since day one on expanding markets for Colorado beef products. We've worked on trade deals with Taiwan, where we had the Taiwan representative here to expand markets for Colorado beef products. I've toured a number of Colorado ranches, and of course, personally, this was one of my quarantine hobbies, was learning to really develop techniques around cooking some of the underappreciated cuts, including flanks and round steak, and of course, I'll put my brisket against anybody's brisket in the state.
Governor Jason Grenauer here from Denver 7. I just wanted to triple check some numbers. Your estimation that the general public could be eligible to receive the vaccine as early as late April or early May. Is that based on current supply, not including the potential for Johnson & Johnson? And with more shots, can we speed up that date to get to the general public sooner, do more mass vaccination clinics just to get to that larger population of Coloradans that are waiting?
Our models do assume Johnson & Johnson. So if there was a setback or a problem with that, that would actually push dates back the wrong way. There is both upside and downside in those long-term projections. We don't have a date. That's why I say could be late April, could be early May. If you want me to give you outside dates, if there's a rapid acceleration of doses, yes, could be mid-April at the earliest. If they don't accelerate and sort of stay with modest acceleration, it could be mid-May. So I think in that time frame, mid-April to mid-May, you kind of have the outside bounds of when the general public will have access to the vaccine. No more phases, no more tiering. Possible criterion based on age. It might simply be 40 and up, and then a few weeks later, 39 and under, or potentially, if the quantity is there, it might just be everybody who wants it. We have visibility into the next 3 or 4 weeks. The rest is extrapolation based on the contracts that we know exist and the best information that we have, which is the same information that you have that's been publicly reported. Did you have a follow-up?
A quick follow-up, if I could.
Mm-hmm.
How is the state going to prioritize the original groups that are at a higher risk over those in the latest phase? A 75-year-old over a 68-year-old over a 60-year-old?
Well, I think all of our providers are committed to prioritizing anybody left from the highest risk groups that wants to receive it or that was sitting on the sidelines. Your window doesn't close if you're 70 and up. We'll have vaccinated 70% of people 70 and up, we hope, over the next few days. And of course we want to keep going. I really hope, especially among Coloradans 70 and up, I hope that 80%, 85% want it. I really hope that's where we top off. That will slow down. That's more of a trickle in the month of March and April, but it is a very high priority trickle. So for those who are sitting on the sidelines, didn't sign up, didn't want to drive to a certain place, want to go to a different place, haven't been called up yet, by all means, if you're 70 and up, you are a priority whenever and wherever you want to get vaccinated.
Hello, Governor. Jesús Carrasquel from Noticias Univisión Colorado.
Hola, Jesús.
Gobernador, ¿en qué fase del plan de vacunación estamos actualmente y cómo cree usted va la vacunación en la comunidad hispana?
Hoy anunciamos que las personas que actualmente trabajan en la agricultura, específicamente en plantas y adentro, y en supermercados, y también todas las personas mayores de 60 años, pueden recibir y vacunarse, empiezan el 5 de marzo. En cuanto a la comunidad latina, seguimos comprometidos a que todas las personas en Colorado sean vacunados. Por esto, esta semana tendremos 18, muchos de esta enfocada en vacunar en la comunidad latina. Okay. Thank you all for joining us.